This short video illustrates the changes that are being piloted to the acute adult Kardex in the Southern Trust. The main changes to the Kardex are: there are now 16 pages. The front page now contains a content section. Page 3 is now where all injectable and oral anticoagulants and antiplatelets will be prescribed. Pages 4 and 5 have a new version to prescribe antimicrobials. Pages 6 and 7 are now for all other injectable medicines. There is an additional page for non-injectable medications on page 11, and oxygen is prescribed on page 12. Page 13 is for recording omitted and delayed medicines. Following a number of serious adverse incidents where patients were prescribed a combination of anticoagulants and antiplatelets, a quality improvement project was undertaken in the Western and Belfast Trusts, which was shown to improve the safe prescribing of these medications. Key points to remember when using this new section are: prescribe all anticoagulants and antiplatelets, both injectable and non-injectable, on page 3 of the Kardex. When prescribing a DOAC such as apixaban, edoxaban, dabigatran or rivaroxaban, remember to cancel any other anticoagulants and always check if antiplatelets are clinically indicated with the DOAC. Warfarin still to be referenced in this section and prescribed on a separate warfarin prescription chart. When administering medicines during the usual medication rounds, always check each page of the Kardex, because the omission of an anticoagulant can potentially lead to blood clots. For example, patient commenced on enoxaparin 40 mg subcut once daily for VTE prophylaxis. Within 3 days, AF is newly diagnosed, enoxaparin is discontinued, and apixaban is commenced.
The Trust is taking part in a research project to improve antimicrobial stewardship. The aim is to slow down antimicrobial resistance and stop antibiotics in patients who are no longer felt to have a bacterial infection. The antimicrobial section has new features that will prompt prescribers to review antibiotics. The key features are: there is an initial antimicrobial page and a finalised antimicrobial page. Both injectable and non-injectable medicines are prescribed on the initial and finalised antimicrobial page. Prescribers are asked to decide if the infection is possible or probable. Possible: the infection is not the most likely diagnosis and antibiotics should be used as a precaution. Or probable: the infection is the most likely diagnosis, but daily review of diagnosis and treatment are still required. The patient has been prescribed piperacillin tazobactam 8-hourly. However, a diagnosis has not been confirmed within 72 hours. The doctor has re-prescribed the antibiotic for a further 3 days. The nurse is able to administer the drug on this page, as each prescription is independent with a separate day, month written above each column for each individual prescription. If the diagnosis is confirmed, tick the appropriate box in the action column and prescribe on page 5, the finalised antimicrobial medication section. Please note that this section is injectable and non-injectable medicines. This example illustrates when a diagnosis has been confirmed. The patient has been prescribed amoxicillin IV and clarithromycin orally. The doctor has completed the probable box. Cultures and urinary antigen tests have been sent. The nurse has availability to sign for the drug for 3 days, and then by day 3 the microbiology result has been received. Pneumococcal antigen positive and sputum cultures returned. The doctor discontinues the prescription and ticks IV to PO for amoxicillin and stop clarithromycin. The doctor prescribes amoxicillin orally 3 times a day, PO, documents infection and stop date for the drug. If you have a confirmed diagnosis before 72 hours, do not wait for the 72-hour prescription to run out. Go ahead and complete the action box and re-prescribe the finalised antimicrobial on page 5. To minimise the number of reviews that have to be completed over a weekend, actively review all patients on a Friday to see if their diagnosis can be confirmed and the finalised antimicrobial prescribed then.